Welcome to another episode of Follow the Brand. I am your host, Grant McGaugh, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal story, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. Welcome to the Follow Brand Podcast. I am your host, Grant McGaugh, CEO of 5-Star BDM, where we help you to build a 5-star brand that people will follow. And we welcome back trailblazers, visionaries, and change makers to another inspiring episode of the Follow the Brand Podcast. And today we are diving deep into the heart of healthcare, technology, and the powerful force that binds them together. Humanity. Picture this. You walk into a doctor's office, but instead of a warm conversation, you are greeted by the cold stare of a computer screen. The physician is typing furiously, capturing data, and it feels like you're lost in a sea of ones and zeros. That, my friends, is the challenge we are facing today. And how do we bring the human touch back to healthcare when technology seems to be driving a wedge between us and the people we serve? So today I have the privilege of speaking with someone who's at the very forefront of this battle, a warrior for truth in the age of misinformation, a bridge between medicine and technology, and a fierce advocate for keeping humanity at the center of it all. Dr. Geeta Nayyar, or Dr. G, as she is affectionately known. She is not just a physician, she is a tech innovator, a best-selling author, and a leader who has stood on some of the biggest stages from Salesforce to CNN to HIM South Florida. And we'll talk about everything from her best-selling book, Dead Wrong, Diagnosing and Treating Healthcare's Misinformation Illness, to her work on AI that truly serves people, not just profits. And we'll explore how she became one of the most recognized voices in healthcare technology and how she is leading a movement to bring empathy back into our clinics and hospitals. But hold on tight, because this isn't just another episode. It is a journey into the future of healthcare, where technology and compassion must walk hand in hand, where innovation means more than just new gadgets, and where every one of us plays a part in shaping a healthier world. So, whether you are a tech enthusiast, a healthcare professional, or simply someone passionate about making a difference, stick around, because today we're not just following a brand. We are following a revolution on the Follow Brand Podcast, where we are building a 5-star brand that you can follow. Welcome, everybody, to the Follow Brand Podcast. This is your host, Grant McGaugh, and I get the opportunity to interview one of the most well-known figures, I believe, in healthcare and technology, and also women. And we're going to have a conversation around humanity in healthcare, which we just had this talk, and I was like, wow, you think that's always been in healthcare, humanity, the human component. But I think we get lost along our journey because there's so many facets to the healthcare systems that we forget why we're doing it in the first place. So I want to introduce you to Dr. G, as she's so affectionately known as, and like to get her introduced to us. Let's have a candid conversation, Dr. G.
Hey, Grant. Well, thanks for having me. I really, really appreciate you having the conversation with me and asking the right question.
Well, that's what it's all about. We have to ask the right question because you are a wealth of information. And I want to know something that's always intrigued me because there's a lot of chief medical officers out in the world. However, there's only one Dr. G. How did you make this transition to becoming so well known? I know you work for Salesforce, you work for AT&T, but you are a well-known figure. Tell us about that journey.
Well, thanks. Well, first of all, you're making me feel really good. So thanks. And let me know what you're doing tomorrow morning. Get my day started. No, I think what has been interesting for me is in so much of what I've done, like many of us, I've either been in the wrong place at the wrong time or the right place at the right time. And I don't think I'm alone. I think there are many physicians who sort of understand the power of technology, but also understand that, healthcare medicine, it is about people. We are in the humanity business. And unfortunately, in the spirit of trying to move healthcare forward, right, the electronic health record being a good example, we moved 3 steps forward and about 5 steps back, right? Whether we contributed to physician burnout or we stopped looking patients in the eye because we were so busy looking at our computers. So I think much of this has just been new territory. And so docs like me or other healthcare leaders like myself are really trying to now in this next era of innovation, particularly when we think about artificial intelligence, trying to get us to get it right. And I fundamentally believe it's about keeping the humanity in medicine and leaving the technology to allow us to do that, right? Figuring out the right things to automate versus the things that simply can't be replaced by technology. But it is a bit of a nuance, and it is a bit of a dance.
I truly get that. I've been in technology 25 years and I understand it. And I've always looked at it, it's an enablement tool, not a replacement tool. It's an enabler. And I haven't been sick a lot. So I haven't had to engage with the healthcare system as a patient very often. And when I discovered that the docs and the patients, they have this interface between them, the EHR, electronic health system or health record. And they spent 1 hour with the patient, 2 hours on the EHR, just inputting information. So you're taking someone and making them a data entry person. I was like, why? That is so inefficient. I don't understand why they're doing that. Now, we're going to talk about that, but you wrote this book on dead wrong, which also got my attention. Misinformation. Now think about it. You got data entry, then you've got misinformation. That could be a soup for a lot of challenges. Would you agree?
Well, absolutely. And it's demoralizing, right? So not only is it inefficient, but it's really demoralizing for physicians, nurses, the whole care team who really went into, for the most part, a purpose-driven profession. And so when a patient walks in and says, doc, I read about this thing and I think I'm going to stick with these supplements as opposed to the medication you might recommend. And on top of that, you're burnt out. And on top of that, you need to over-document that conversation because it's not the standard of care. And you have to document all the things that you discuss, the pros, the cons, et cetera. So it has become a complicated environment to practice in. But therein lies the opportunity, right, for technologists such as ourselves to really flip that narrative.
This is so important because not only are you a physician, but you also took on this mantle of understanding technology, how you can utilize technology to get better health outcomes. That's really the goal, is better health outcomes. How did you make that? I mean, you worked at Salesforce, you worked at AT&T, you do a lot of work with HIMSS. Did you just have the passion to be both a physician and a technologist and just kind of merge those things together to create the Dr. G that we know today?
You're so funny, Grant. I love you. You're great. Look, I just happened to, like I said, be in the right place at the right time. My generation of physicians went from paper to digital in our residency, actually. And so I very much saw what paper allowed us to do, which was look our patients in the eye, write a short but meaningful note that perhaps only 2 people could read. And then the digital note, which now, for those of us who were around during the Encyclopedia Britannica, is now the Encyclopedia Britannica. It's actually not very meaningful. It's quite long, often copied and pasted from multiple folks. And we no longer look our patients in the eyes. And even though we were promised this would be information we shared, we still have the same data silos that we had in paper, right? So physicians like me really understood what paper and technology could do side by side. Now, that isn't to say that there's not more opportunity to get this right. We've seen this. We see that telemedicine is now here to stay. We see that analytics is a possibility, things we can do with clinical trials. So there's so much opportunity because of the EHR infrastructure that has been started, but there's still lots of gaps. There's still lots of gaps that we're faced with that we had even when we had paper. And so really that's what I've, dedicated myself to, is just how do you get this right in this era where there's no dearth of technology, but how do we also do it in a way that empowers both the patient and the physician? Because there really is no good consumer experience if there's also not a good physician experience.
I agree. I totally agree with all of that. And you got a lot of, I would say, airtime during the COVID time period. And that there was a lot of information or misinformation out there. COVID was a test, talk about a worldwide test of all of our healthcare systems and our knowledge around healthcare. You even alluded to earlier, a lot of people were like, maybe self-diagnose themselves. And like, you know what? I feel I can do this, I'll do that. And then not listening to a physician who has a lot of experience and they're kind of diagnosing on their own. You wrote this book on dead wrong. What motivated you to write this book, and what are you hoping that people will get out of it as they read through it?
Thanks, Grant. So look, the inspiration for the book was really the way I felt when COVID happened. I was actually sitting here in my home office, and I remember it feeling like a deja vu moment from the HIV/AIDS epidemic. And the book actually starts out in chapter 1 with my patient, Jerome, who dies from AIDS. And it was a very similar public health crisis in that mis and disinformation was taking over the narrative. And I talk about Jerome to his dying day insisting that he was not a homosexual, could not possibly have AIDS, and I was clearly wrong as his physician. And we saw the same thing with COVID, right? The stakes being just as high with regards to infection control, with regards to morbidity and mortality. And I felt it was the time to tell this story because in healthcare, as healthcare leaders, as clinicians, we've always accepted that people got the facts wrong. We've always accepted that mis and disinformation was just part of the wallpaper at the hospital. It was just something in the background. We didn't really pay attention to it. But what's happened in the era of technology that we're in is that mis and disinformation is actually getting worse because of technology, right? And because of the consumer-centric world that we have, and because we have devices on every wrist, every finger, everything we can carry is carrying information in a way that we didn't have in the past. So while mis and disinformation may have been around since the Black Plague, it's now actually getting harder to get the facts and the truth out there. And we've lost a lot of trust in science, particularly since COVID. So the book is really a call to action to healthcare leaders to say, no one is coming to save us and no one is coming to save our patients. And it's time that we start deciding what the wallpaper is in the hospitals that we practice, because inevitably, it really is us that clean up the mess. Right? Inevitably, the patient who doesn't get the prevention, doesn't get the medication, doesn't see the doctor, ends up in the emergency room and generally overburdens the system and also has a really poor outcome, right? So how do you instead flip the narrative, and we as science experts or medical experts or healthcare leaders owning that conversation, owning the narrative, and also putting technology strategies in play that understand that 59 million Americans turn to social media for decisions about their healthcare, that understand that we have a workforce shortage and burnout issue. So there just are less people to answer the question for the average consumer, right? And so how do we actually, in a post-pandemic world, meet the moment and understand that mis and disinformation is, in fact, one of the issues we need to handle and not just an afterthought as it has been to date?
That's so important. Meet the moment. I love how you just stated that. and being transparent about the situation. We are in the consumerization of healthcare, and we're getting inundated with a lot. I see so many ads, but I never understood that, to be honest. And I hope our farmer people will listen to this podcast, because as a consumer, I sit there and I see these advertisements on different medications, and I'm like, I'm not a physician. Why would I know or make a decision about this type of pill that possibly can help me? I'm not sure. And then I always say that at the end, they always have these disclaimers about stuff. Well, dude, it has this side effect, that side effect, this side effect, all this other stuff. And I'm like, God, does this actually work? People actually go out and buy this stuff and, tell their doctor, I'm going to take this instead. I'm not sure. I think there's a lot, there's a lot of confusion in this space, and I don't know how it all works, but there's a lot out there. I don't know. I want to ask you a candid question. Do you think that type of marketing of pharma is effective? Ready to elevate your brand with 5-star impact? Welcome to the Funnel Brand Podcast, your gateway to exceptional personal growth and innovative business strategies. Join me as I unveil the insider strategies of industry pioneers and branding experts. Discover how to supercharge your business development, harness the power of AI for growth, and sculpt a personal brand that stands out in the crowd. Transform ambition into achievement. Explore more at firestarbdm.com for a wealth of resources. Ignite your journey with our Brave Brand Blueprint and begin crafting your standout 5-star future today.
Well, look, I think mis and disinformation affects the whole industry, from the life sciences space, the med device space, the payer provider space. I think if we all tackle it together, there are ways to partner with life science companies, med tech companies, and patient advocacy groups, right? Because it does help. It does help in terms of patients being aware there are treatments, funny names being made mainstream. One of the things we saw during COVID was people, knowing the name of vaccines. That never had occurred before, right? Did you get the Pfizer shot? Did you get the J&J shot? Right? That was kind of funny, humorous for doctors, because no one's ever asked us that before, right? It was just the flu shot before. And so in some ways it does raise awareness. In some ways it raises education, but it always is the right balance and the right partnership. And I'll give you a simple example. So as a rheumatologist, we give some pretty complicated biologics, and there are a lot of side effects. So when the commercials say, liver disease, renal disease, and they narrate it out, it's the truth. But by having that introduced to my patient in tandem with me, then we talk about it, and I'm able to say, look, the reality is there are side effects to this drug, just like there are to Tylenol, by the way, if you look at the side effects of Tylenol. But when managed correctly, when we partner together, when we do blood work regularly, when we dose things correctly, when we monitor your symptoms, those are unlikely. The risk benefit in medicine, we always weigh the risk and the benefit. There's always risk. You cross the street, there's a risk, right? But the benefit is you get somewhere, you're going somewhere. And if you're mindful, right? Simple analogy, you look left, you look right, you look left again, you make the dash. It's unlikely, right? You're going to have that risk. So that's the important piece, is how do we actually all still empower the patient-physician relationships? And so I think there is a role for life science companies, med device companies, to empower that relationship. It really comes down to that. Same with the technology. I'll say it again. If you are not getting between the doctor and the patient, you keep the humanity in the center. And the more you can take all of the other inefficiencies in the background away, that's the key. Those are always going to be the strategies, the technology strategies that work. Those are always going to be the mis and disinformation strategies that work. And we just have to get back to basics in many ways.
I agree with you. Back to basics. The human factor, the convergence of humanity, technology, and the clinical world. And what does that look like? Now, I'm going to change the subject just a little bit, because another thing I'm very impressed with, and I work with some of these large technology companies, and you don't see a lot of women in the technical space. And also, even in the medical space, at the higher levels, you have been able to transverse both of those, and you're an advocate for women in leadership and that type of thing. If you were a woman today and you just, got out of school, perhaps you're now on that track to become a physician, what advice would you give to them?
Well, this is actually one of the things I'm very intentional about. And in my book, you'll see that there are two young female illustrators. One is my daughter, who's 12, but at the time was 10 or 9, and Sneha Akarati, who is now a first-year medical student. She was a pre-med student at the time, did the illustrations for the book. And I'll tell you, Grant, it's about being intentional. So I'm a big believer that talent is everywhere, but opportunity is not. And so I would say for my generation, those who are in the industry, both men and women, creating opportunities for people, but then also reaching out. I think the 20s and 30s in particular, finding potential female leaders in their 20s and 30s, it's the biggest delta. It's the biggest delta. If someone in my 20s or 30s had given me a stair step to just climb, I could have avoided a lot of missteps. I could have avoided many hardships. And I think what I would say is, if STEM is your passion, STEM is the way you change the world. And to be unapologetic in looking for mentors, both men, women, culturally, for myself, the South Asian community is one I have invested in and has invested in me. But wherever you find it, because I've had any number of mentors that are largely not from my community and are largely more men than women. I simply couldn't find those folks, but I think that has changed progressively. And so one of the things I would say is for women who have reached a certain stature to turn around and look back, right? Turn around and look back. It's really about creating opportunity. I do believe the talent is there, but opening the door, creating an internship, having a conversation. And as a young woman, I think it's raising your hand and being in places and creating networks. Anyone can read a book, but I think having a healthy network, being a collaborative leader and someone who's not afraid of hard work. I mean, these are all things I tell my 12-year-old. So whether you're 12 and above, or a female or a male, frankly, I think that's just par for the course if you're looking for an ambitious, impactful career.
I like that. Intentional. Be intentional. Knock on those doors. And get that seat at the table and bring a.
Well, all they can say is no. And I think this is something I tell my daughter all the time. Okay, so you get rejected and you're stung for a few minutes. If somebody says no, they were never the right person anyway. But you're not left with this what if moment. What if I had just asked or gotten that business card or made the extra time to go to that event, whatever it might be. But I think sometimes women were like afraid of rejection, or it's a very human thing to just fear rejection professionally, personally, right? And so I think encouraging rejection and encouraging failure. Let me tell you, somebody was asking me this question about the book, and they said, "How did you get a publisher?" And I said, "Well, it's very simple. I'm someone who's incredibly motivated by rejection. I was rejected so many times, it only made me more furious. It just made me more furious. And so I just submitted again to somebody else, and then to the next one, and the next one, and the next one. And I have this attitude of, in spite of you, I'm going to do this because I'm so passionate about it. And I think you just have to have that thick skin. And I think women sometimes, we internalize a lot of things, and you just can't. It's not personal. It's not for me. I was an untested author. Of course, I was going to be rejected, and it actually had nothing to do with whether I was a woman or not. It's hard to get your first break. That's the world. That's the industry. So you chin up and you move forward.
I love that. Love that perspective. And I'm telling you, I've been working with Dr. G, and I reached out to her because she was at HIMSS conference. People don't know HIMSS, Health Informatics Management System Society. It's a big word, right? But it's HIMSS, as everybody knows it, right? And I saw her up on stage, and she was moderating a couple of different panels, and I said, wow, she's a great speaker. Then I come to find out that she lives in Miami. I'm in Miami. Like, wow, she went to the University of Miami. I said, no wonder would she come and speak at our regional HIMSS Integrate conference. And before that, you had talked about her just doing a segment on for women in technology, and we were looking to do that. Now, you have to be persistent. First of all, to get on her schedule is like I got the golden ticket, right? It's like winning the lotto, right?
You are too funny. You are too funny. Well, I'm thrilled to be there. I always love doing things in South Florida, Miami, in my hometown, in my community. So thank you for the invite, Grant. I'm really looking forward to it.
Oh, we're going to have a great time. You're going to come, you're going to kick everything off. We're going to have a wonderful, wonderful one-day conference. You're going to be one of the headlines. We've got also two other individuals that will be a part of this as well. Actually, it's an all-day conference. So there's many individuals that are going to be a part of this. We want to see if we can get Hal Wolf to make an appearance, but we'll see if we can get him to do that as well. But we have Ed Marks also will be speaking. And then Patrick Hale from Vitas, if people are not aware, that's the largest hospice. I would say, I wouldn't call it a hospital, but it is the largest hospice provider in the United States. So they're all going to be there. So give us this. What do you now? You're thinking. I know you're thinking through this. It's going to be in October. Give us a little preview. What do you think is important for that kind of audience, local healthcare and hospital providers, to really hear from you? Because you've got AI that's out there, you've got all kinds of leadership issues out there, you've got a lot, how do we get by with the monies that we have? There's budgeting issues, there's all kinds of things that are out there. What kind of message do you want to give to us?
Look, I think the message I would give to our community, as well as any community in the healthcare space, is that we are in the most exciting time to be a healthcare leader. I mean, we are living in a post-pandemic world where there's no dearth of innovation. Whether you're talking about AI, EHRs, remote monitoring, devices like these that we all have on our wrists and our fingers, there is no dearth of innovation. It is all in the application of it. And we have to, again, we need to focus on what drives revenues in the healthcare space. It's the doctor-patient relationship. What makes people make that appointment? What makes people follow up? What makes people get that mammogram and that colonoscopy? It is fundamentally that relationship. And so whatever piece of the puzzle you're on, you want to ensure that you are not getting in the way of that relationship, whether it is the implementation of AI, whether it is the way you are moving forward with your EHR initiative, whether it's the way you're thinking through your telemedicine strategy. And I'll give you some simple examples, right? With the EHR, for example, we solved 3 problems and we created 5 new ones. We literally launched a scribe service. I mean, the EHR is supposed to document, and then it did it so badly, and it was so non-intuitive to doctors, we now put a 3rd person in the examining room. Meanwhile, the doctor is asking you about your family history, your sexual history, your alcohol, tobacco use, drug history. We changed the relationship, right? And we largely made it an inefficient workflow. I think we have an opportunity to fix that, particularly when it comes to generative AI. And when it comes to things that are not so sexy to talk about, right, Grant? Clinical decision support, prior authorization. That's the friction. That's the friction in healthcare. And if we remove that friction, we will actually improve the relationship and drive those efficiencies of the economics, right? The economics, we can see more patients. We can generate more revenue. We can generate more valuable visits, right? And then finding the right places for telemedicine, which is also very efficient if done correctly, if it's for the right specialty and the right type of patient. So I think that's the next era of healthcare transformation. It requires true healthcare leadership and also a reflection from the technology. We've had technology around for a long time. We've had AI around for a long time. So what are the lessons learned? What are the things that we now need to stop for a minute, reflect and learn, and then point such a powerful technology like generative AI at? But the technology is only going to amplify either our bad habits or our good habits. And so we have to understand that data silos exist. AI is not going to fix that. AI is not going to help us with that. So it's only going to be as smart as those silos, or it's only going to broaden health equity. We have to still fix all the stuff we have to fix, but there's a lot of low-hanging fruit that even if we just start with that and crawl, walk, run, we can get to a much better healthcare system.
I love crawl, walk, run. I'm very, very familiar with that. I think some people get intimidated by technology and they feel like it's a replacement. It's just going to be worse. And I know a lot of people in the clinical space, they saw what happened with the EHRs, as you alluded to, and they're like, oh my God, here's more of a problem. I just want to heal my patient. I want something that helps me do that, not something else that takes away from my clinical support, diagnosis, treatment, all of these things. And we need voices like yourself so people will then understand how they can point and direct different technologies in a way that you do absolutely get better outcomes. Now, one other question, because we got to know this, how do we get a hold of this book that you've got out there and what you're doing? And before we even talk about how to get hold of it, tell me again, what motivated you? What did you feel you were passionate about, you were furious about, that you needed to get this book out there for the public?
Well, again, Grant, thank you so much. I mean, the book is available anywhere books are sold, Amazon, Barnes & Noble, wherever your local bookstore is. The book is now a Wall Street Journal and USA Today bestseller, so very, very proud of that. And thank you for that. Look, again, for me, it was a flashback to HIV/AIDS, but it was also just a state of the industry. Right, state of the industry in an era where 59 million Americans turn to social media for decisions about their healthcare, or an era where now the wearable market is a $54 billion market in 2023, and it was a $24 billion market in 2019. It's telling you the consumer is interested in their health. They're hungry for their health. They're thirsty for their health. So much so they're going to spend money out of pocket to measure their steps, their mood, their pulse, anything that can be measured. The consumer is measuring it, even if they don't know what it means. Because they are so interested in their health in a post-pandemic world. And so it really is about meeting the moment, understanding that mis and disinformation is the wallpaper we as healthcare leaders need to determine. What should that wallpaper be, right? We can't just be these passive observers saying, yep, that's just the world we operate in. And that no one is really going to save our patients or ourselves. We are going to have to do it as healthcare leaders. This needs to be a strategic priority, whether you're on the payer, provider, life sciences, med tech side. The reality is that mis and disinformation is impacting your business in some capacity. And if you are in charge of consumer experience, if you are in charge of or interested in patient acquisition and retention that drives your revenues, if you're interested in a happy, healthy workforce, this is an issue that you have to tackle, and every organization has someone in charge of that. And yet, whenever I ask who's in charge of the mis and disinformation strategy, no one raises their hand because it's the wallpaper. And so it's really a call to action to say that has to change, and that the world we're living in and the healthcare world we're living in for tomorrow, this is going to be a bigger and bigger issue.
I totally get that. I love that call to action. So important. I'm going to tell our audience that you definitely tune in to you on LinkedIn. I see a lot of your information on LinkedIn that you have. So Dr. Geeta Nayyar, you also have a website that people can go to get a lot of your information and book you for speaking engagements.
Thank you, Grant. It's pretty easy to find me. So thank you. I appreciate that.
Well, we're going to find you here. I think it's on October 24th. You're going to be in South Florida. You're going to be at the HIMSS Integrate. You're going to do some book signings. So if everyone who wants to come down, maybe if they already purchased your book, maybe they can get it signed, or they can buy one right there at the conference. I want to thank you again for taking the time to meet with us as this precursor to you coming live here in Miami. You got to get you live in your hometown, right? Sometimes you got to get out. Like, hey, I can just pump my brakes and be right here in the Miami area and do some things. And I really appreciate you taking the time to do that.
You bet. Thanks, Grant. I'll see you soon.
Absolutely. You take care. Thanks for joining us on the Follow Brand Podcast. Big thanks to Full Effect Productions for their incredible support on each and every episode. Now the journey continues on our YouTube channel, Follow Brand TV series. Dive into exclusive interviews, extended content, and bonus insights that will fuel your success. Subscribe now and be a part of our growing community, sharing and learning together. Explore, engage, and elevate at Follow Brand TV series on YouTube. Stay connected, stay inspired. Till next time, we will continue building a 5-star brand that you can follow.